Good morning. My name is Monica Williams. I'm one of the dermatology residents. I'm a PGY3 at Georgetown University. This morning, we're going to discuss a case of fibrofatty change that was seen in a spontaneously involuted infantile hemangioma, which we subsequently treated with radiofrequency microneedling, and the patient was indeed a skin of color patient. Unfortunately, I have no disclosures. And so just a little bit about infantile hemangiomas. So as we know, infantile hemangiomas are the most frequently occurring pediatric vascular tumor. There are common residual sequelae that are found in infantile hemangiomas, and that includes telangiectasias, fibrofatty tissue residuum, secondary anedoderma, redundant skin, and scarring. Residual change is seen in 46 to 69% of untreated infantile hemangioma patients. However, treated hemangiomas may also exhibit residual changes, and 50% of infantile hemangiomas have had these changes status post-PDL treatments, and 27% after propranolol therapy. There are several mechanisms that have been elucidated in the differentiation and development of fibrofatty changes. While there are an abundance of literature and studies addressing the treatment of infantile hemangiomas, the literature concerning the long-term implications as well as the sequelae in their management are very sparse. It is important to consider potential pigment alteration and scarring that may occur when using energy-based devices and procedural interventions in skin of color patients. Radiofrequency microneedling has been successfully used in skin rejuvenation, skin tightening, and scar treatments to include acne scars. There are no reports of RFM in the management of infantile hemangioma sequelae to our knowledge. Thus, we report a novel use of RFM for the management of fibrofatty change following spontaneous regression of an infantile hemangioma in a skin of color patient. So our case. So here we have a 45-year-old female who's light brown to medium complexioned who presents to the dermatology clinic with a history of a childhood birthmark which was red and regressed spontaneously. Though the lesion did regress with time, the patient presented to the office because she was reporting that this area was now aging faster than the rest of her face. The birthmark had never been treated, and there was no history of any symptoms like pain, ulceration, or bleeding that the patient could remember. Given the morphology of the lesion, which we can see on the right, so here she has a hyperpigmented and telangiectatic atrophic plaque of the right cheek. There's some marked fine wrinkling as well as redundant skin at the anterior edge. There were no changes found on the contralateral cheek. Given our patient's skin type, careful consideration was given to the use of energy-based devices and procedural interventions for her. So to manage her, we decided that we would start with radiofrequency microneedling. So we did radiofrequency microneedling spaced 3 months apart using the devices listed. The device does have auto low power settings and a 49 needle tipped pin. We did 3 successive passes of decreasing depth for each treatment, and you can see the successive depths, which are listed on this slide. 1 month status post round 2 of RFM, we can see in the picture that there was marked improvement in skin atrophy and fine wrinkling without any evidence of device-induced hyperpigmentation or scarring. While we did not, so just a little bit about the management of infantile hemangiomas. While we did not find any data specifically addressing the management of involuted infantile hemangiomas, we do know that surgery, injectable fillers, as well as ablative and non-ablative lasers have been reported in the treatment of anedoderma and facial lipoatrophy. Many of these procedures do carry risk in skin of color, thought to be due to the excessive inflammation, heat, and epidermal disruption that may lead to dyspigmentation and scarring. There's also some limited data on the use of ablative laser and interlesional deoxycholic acid in Fitzpatrick skin types 5 through 6. In radiofrequency microneedling, as we know, individual needles deliver thermal energy to the dermis via transepidermal channels, reducing heating of surrounding tissues and diminishing the risk of hyperpigmentation or scarring. Coated needles further reduce this risk by decreasing injury to superficial structures, and we did use coated needles in our patient. Surgery, injectable fillers, and non-ablative. So here, I just wanted to point out, these were some studies that looked at the histopathological analysis of patient tissue after RFM. And here we can see that neocollagenesis, elastogenesis are induced after RFM treatment. Additionally, it's been shown that angiogenesis is also induced. Real-time polymerase chain reaction tissue analysis also demonstrates elevation of genes that we know are involved in dermal remodeling. In conclusion, our case demonstrates successful use of RFM in the management of lipoatrophy and deep wrinkling in an involuted infantile hemangioma. Microneedling is known to be safe in the treatment of a broad range of scarring conditions and relatively safe in all skin types. Further, radiofrequency microneedling in skin of color demonstrates few adverse events. Those studies are limited and evidence strength is low. Our results support the use of RFM in the management of fibrofatty atrophy associated with involuted infantile hemangioma. This is particularly important in patients of color, given the lower risk of scarring and pigmentation alteration that can occur with these more invasive procedures. I'd like to thank my mentor, Dr. Marl Skelsey, for allowing me to be a part of and present this very interesting novel case of radiofrequency microneedling use for the atrophic plaque. Thank you so much.
Great job.